I'm Anthony Sanchez, medical student at Florida Atlantic University. Today I'll be presenting my research on psychotropic polypharmacy in older adults. I'd like to thank Drs. Gabriela Engstrom, Bernardo Reyes, and Joseph Auslander for their guidance in this research. Psychotropics include anxiolytics, antidepressants, mood stabilizers, antipsychotics, and stimulants. These drugs, psychotropic drugs, are associated with adverse effects in older adults, namely falls and the related injuries, glucose intolerance, sedation, and death. Psychotropic polypharmacy, therefore, is the overprescribing of these groups of drugs. Patients with dementia and those in long-term care facilities are at particularly high risk for this type of polypharmacy. The aims of the study were to identify the rate of psychotropic polypharmacy in an older adult population. We also sought to identify the relationship, if any, of psychotropic polypharmacy to dementia, to admission from and discharge to long-term care facilities, and also to 30-day hospital returns, accounting for comorbidities. We hypothesized that patients with psychotropic polypharmacy would be significantly more likely to have dementia, to be admitted from and discharged to long-term care facilities, and to return to the hospital within 30 days. For this study, we defined psychotropic polypharmacy as 3 or more psychotropic medications. Hospital returns were defined as including visits to the emergency department without admission, as well as any admissions to the hospital within 30 days of admission. For comorbidities, we identified these using ICD-9 and 10 codes. This data included an analysis of patients aged 75 and older who were admitted to non-ICU beds in a community teaching hospital from July 2015 to June 2017. Data was obtained on the percent of patients with psychotropic polypharmacy who had dementia, who were discharged to and admitted from long-term care facilities, and those who returned to the hospital within 30 days. And we compared that to patients without psychotropic polypharmacy for these same parameters. Chi-square analysis was conducted for each of these groups. So if we look at figure 1 in the results column, you can see our total patients for this research was 24,776, of which 8% were found to have psychotropic polypharmacy. Psychotropic polypharmacy was significantly associated with dementia. Patients with psychotropic polypharmacy were also significantly more likely to be admitted from and discharged to long-term care facilities. Also, patients with psychotropic polypharmacy were more likely to return to the hospital within 30 days. And I'd like to direct you to Table 1 to analyze this last point a little further. Patients with psychotropic polypharmacy were more likely to return to the hospital in 30 days. However, this is only true in the presence of specific comorbidities. As we can see again in Table 1, those comorbidities were COPD, general polypharmacy, kidney disease, and hypoalbuminemia. The conclusions for the study was that patients with psychotropic polypharmacy were more likely to have dementia. Patients with psychotropic polypharmacy were more likely to be admitted from long-term care facilities. This may relate to the higher incidence of psychotropic polypharmacy that is found in long-term care facilities. Patients with psychotropic polypharmacy were more likely to be discharged to long-term care facilities. This may relate to the comorbidities previously highlighted in Table 1. However, further research is needed. Finally, some of these associations may be explained by a confounding by indication, in which sicker patients may be more likely to have psychotropic polypharmacy as well as return to the hospital. I hope that this research and research like it can help clinicians who are managing older adults, especially those older adults that are in long-term care facilities. Thank you.